Coming up on episode 58 of Fresh Freedom, Americans are fed up with inflated premiums and coverage that doesn't deliver. Lauren Stewart joins us to expose what's broken in our healthcare system and the real solutions that can finally fix it. Welcome to the Fresh Freedom Podcast, featuring freedom-focused representatives and policy experts who are fighting for conservative values and defending your constitutional rights. I'm Nate Lucas, as always, joined alongside Representative Eric Burleson from Missouri's 7th District, and our special guest is Lauren Stewart. Ms. Stewart works on federal health care policy with Americans for Prosperity and Concerned Veterans for America, where she helps advance patient-centered reforms through the Personal Option Initiative. She has over a decade of experience in advocacy and grassroots organizing, working on major policy fights at both the state and national levels. Lauren, Congressman, great to be with you both.
Thank you for having me.
This is kind of sad, but I went on like a YouTube rabbit hole last week.
Boy.
Because healthcare has been debated in this town for a long time. You're only in your second term in Congress, so I'm not pinning this on you. But it was funny to go back and watch, people in the House and in the Senate, even from 2013. They have a few more grays now than they did back then, but it's unbelievable. They were saying the exact same things about how broken Obamacare is, how we need great reform in healthcare. And here we are in 2025 having the same debate, and it was just astonishing to hear almost the verbatim same language being discussed.
Yeah, I think that was one of those defining moments for me that was the most disappointing. Just, sitting on my couch back home watching the Republicans fight over here to repeal, they voted 100+ times to repeal Obamacare, and then they get to the actual meat of the matter, and they don't accomplish it. Yeah. And then they put forward this milquetoast alternative that was just actually more bureaucracy and just exactly what you would expect from the swamp. And so I'm hopeful that maybe, just maybe, it's primed to actually do something good.
Yeah, on 2013, 2014, I remember kind of cluing in and just hearing, I was not involved in healthcare policy, but just hearing the issues with the system. I had started kind of seeing it within my own family, within my parents' healthcare there in Massachusetts. So it's a whole other world of bad there. They double down on everything that is wrong with Obamacare. And just remember, I was much younger, but practically speaking, thinking, how is this going to actually work? And oh my gosh, this coverage sounds like it's going to be really low quality and really terrible for the people that they're saying need to be on it, the most vulnerable. And that's exactly what's happened. That is exactly what has continued to happen. What is a lot different between 2013, 2014 time to now is even back then when we were touting how expensive and how low quality coverage Obamacare was going to be, premiums have increased 75% since that time. Since we were talking about how horrible the ACA was going to be, premiums have increased 75%. So we have just continued to slide down a very, very dark hole in healthcare, and provider networks continue to shrink. What you have access to, the claims denial rates are, more than they were back then when we were saying it was horrible. I mean, we're in the same but darker place in terms of healthcare.
To your point, the end result was fewer companies controlling the healthcare system. And, big business loves big government.
Yes.
That's exactly what we gave big business was a big government healthcare policy. And when people say, why are my health insurance premiums so high? Well, there's only 5 carriers now.
Yeah.
Because we regulated the hell out of all the other ones. So now only 5 national carriers. And I mean, that's not real choice. So, I mean, and from beginning to end, this country on the federal level and the state level has throttled back the access to healthcare, whether it's saying you can't use that doctor to remove a wart or that because they're not in your network, and you can't use a nurse practitioner because they're not, they haven't, don't have an MD or a DO next to their name, right? Or you cannot, you can go talk to the pharmacist, but you're going to have to get an appointment and get in line to get a meeting with your doctor before you can actually go back to the pharmacist to get the prescription that you probably, if you cross the border, would be able to get without talking to anybody.
Yeah.
Or not only across the border, but like in Europe. Mm-hmm. So we have absolutely throttled back every aspect of the healthcare industry, and then go, well, why doesn't free market capitalism work? Well, because this is not free market capitalism. It's the exact opposite.
It's the complete opposite. I mean, healthcare, for instance, when you go to any other place where you purchase something, a car, the grocery store, you know that apple is $1.39 a pound. You know what the prices are. You could walk into a doctor's office. They could tell you, hey, you need this procedure. And you ask, what is it going to cost? And their face goes blank. And they say, well, it depends on your insurance. That says everything to me. It depends on your insurance, because who controls all of the dollars in American healthcare now? It's those 5 large insurers that you were talking about. So I grew up in a house where if I didn't like what we were having for dinner, my dad would say, it's the golden rule. He who has the gold makes the rules, and you better eat your broccoli. Unless you want to, buy dinner for tomorrow night, this is what you're eating. That's what the insurers, the health insurers, are telling all American patients and families. Now, when we talk about how there's about 5 really large ones, the Affordable Care Act and Obamacare was the first move towards that single payer system, right? Mm-hmm. Really starting to consolidate who can pay for healthcare, and then who can decide what doctor you go see, what medicines you can get, and when. So it's very much that golden rule. And just imagine if we keep going down this road, and I truly hope that we are not, but things like Medicare for all, a public option, not options, a public option, just consolidates that further. So premiums would continue to go up, access would go down, and the control of American patients and families would be completely out the window.
One thing that is really critical in this town is messaging. And I guess it's kind of been an Achilles heel, so to speak, for Republicans over the course of time, trying to get the message to stick. It's a wonky discussion. I mean, healthcare in general is just kind of like, meh, until you need it, obviously.
It made it that way.
But, I mean, so where do you think the messaging stands right now, and how have Democrats been able to capitalize on good messaging, and how can Republicans move the ball to get better at messaging?
I would say healthcare, more than any other issue, is very personal. It's something that will hit home when you hear that our healthcare system costs trillions of dollars. I mean, to the everyday American, $5 trillion to $20 trillion, $40 billion, like that, those are all just big numbers, but they definitely want to make sure that their mom or their grandparents have high quality care. So I feel like Democrats have really honed in on that emotional side of the argument and really generating fear around what will happen if there is not the Affordable Care Act, if there is not universal health care coverage. What the big thing, kind of pulling back the curtain on their messaging, they're talking about coverage. What we're finding is that coverage does not equal care.
That's right.
Absolutely, 100% coverage does not equal care. You do not get quality health care with an Obamacare insurance plan. In fact, you get a lot less. Over a third of claims last year were denied for Obamacare enrollees. But I do think that their side of the argument in being so fearful and driving really extreme narratives does hit home to people, just practical people saying, well, I don't want that to happen. And I think historically, much better now, we've been focused on the cost. Rightfully so. Rightfully so. A small portion of Obamacare costs $400 billion over 10 years, and that's a very small portion of the program. And again, it's low quality care, it's restricted access. So the numbers side are important, but I think in terms of solutions and the way forward, that's where the opportunity is now.
Yeah. And I think Democrats are good at leaning in, like their front foot forward is the emotional, like you said. But like we tend to drive the policy and the programs and say, because right now what I'm hearing from Republicans on Capitol Hill is, which are great ideas, let's take the health savings account, let's tweak it, we'll expand. and say, reduce some of the restrictions on it, expand the amount that you can put into it, that kind of thing. We'll take ICHRA and we'll make some tweaks to ICHRA for anybody that knows what ICHRA is.
Yeah.
Right. So all of these, that's the way Republicans talk.
Yes.
But the truth is what we should be saying is, why do you let your employer pick which hospital system you're going to go to? Why do we let them pick, what insurance carrier you're going to use? Why are we letting your employer or the government pick what PBM? Like, if you don't want a PBM, you shouldn't pay for one.
Right.
But you may find that it actually saves you money. I don't know. But at least let the consumer have those choices. But instead, all of it's being made by government and employers. Wouldn't it be nice if you got to pick the healthcare that you wanted? Because I think if you unleashed the American people and gave them that kind of freedom, healthcare freedom, really,
imagine.
then look at what's happening with direct primary care.
Yes.
And the number of people that are finding amazing, services and the satisfaction rates with these direct primary cares are through the roof. But they're not included in any of these plans. So, but if you just said, we're going to let you decide where your healthcare dollars are going to go, we're going to give you a purse or an account, and then you can pick. If you want to do direct primary care, you can do that. If you want to get a high deductible plan, you can do that. If you want to get a PPO or an HMO, then go knock yourself out. But if you want to do a ministry sharing plan or an association plan, whatever you can find, spend the money because it's your money. And the federal government's just coming alongside, encouraging you by providing the tax deductions. That, to me, if you really kind of give people that kind of freedom, I think that will excite them.
And these things that you're talking about, direct primary care, health savings accounts, just increase the quality of care you get. They might look like light coverage or junk plans, as some folks have called things like short-term limited duration plans, which are really great for younger, healthy people who are just getting started in the workforce. But the type of quality care we're talking about wanting all Americans to have, people in Hollywood and Beverly Hills absolutely have. They are not being told, you can't go see that doctor. You're not going to get that medicine when you want it. They don't even wait to cure a hangover, I bet. Right. Mm-hmm. And we just want to make this level of accessibility because the innovations are there. I think innovations such as telehealth, direct primary care, concierge care is absolutely fantastic. But right now, government, specifically Obamacare, is farming all of those out so that a very, very small portion of the country has access to it. And I think you're right. It would go a complete long way to just unleash the American population. Think of suburban moms or even, single young guys, like them getting to pick the plans. It would be a completely different, not one size fits all, not between 5 different choices. You would have complete polar opposite plans that would work perfectly well in each individual situation. And we should be empowering that.
So with the health savings accounts, like when you word those properly, and you sell those to the American people, I mean, you have polling numbers that suggest it is not just like 51, 52%. No. We're talking like 70, 80% of people are like, yes. Yeah. That is the solution.
Yeah, absolutely. If you want to talk about an 80-20 issue in healthcare, that is 100% health savings accounts. 87% of Americans that we polled said that they support health savings accounts. They would support legislation that expanded eligibility to health savings accounts, and especially thought that lower income Americans should have access to that tool, even if they're on a government kind of federal health program, but to be able to empower themselves to shop in and out of network. I mean, this is something across the board that is hugely politically favorable. I do hot yoga in Alexandria, Virginia, Northern Virginia. A number of the ladies in that yoga studio do not vote the way I do, but if you told them that I was taking away their HSAs or that they weren't able to use it for hot yoga anymore, they would be very, very upset because it's a benefit that they have and they love personally to their family. So
I had no idea you could use I never thought about hot yoga.
Yes,
you don't do it every week.
You'll have to come.
There's no goats involved, right?
No, there's no goats. I'm not sure if goat yoga is qualified for health savings accounts. But look, the way that works is if you get a letter of medical necessity from a physician that says, hey, this person has chronic back pain because they've been in an accident or they have really, really bad anxiety. And this clinically we know is helpful. Even better that they're not immediately just going to a drug that they might have to be on the rest of their life. You know, this is something actual wellness that we incentivize, but you know, it cuts cross-party lines in terms of benefits. Some people use it for, I buy my son's infant Tylenol with HSA, and anytime it's the end of the year and I have a little bit left over that I don't want to carry over to the next year, because that's another amazing benefit of these accounts is you can roll them over year after year. So you can, if you're younger, and build up that savings over time. You can save if something catastrophic happens and you have that extra money, tax advantage dollars to be able to pay for it. But I'll go on the Amazon HSA FSA store. I mean, the places that you can use these incredibly beneficial health tools now are absolutely everywhere. So it's no wonder that they're starting to gain more political favor. What is shocking is that only 10% of the population has access to a health tool that polls almost 90% in support of.
Yeah, because we've restricted it. We've said you can only have an HSA if you have a high deductible plan.
Right, which is a very small part of the population that's willing to take that risk. So Democrats will say health savings accounts are tax benefits for the wealthy. Well, they're regulating them that way. We would like everybody to have a health savings account. I wouldn't want to mandate it, right? It doesn't necessarily, it works great for me. It doesn't necessarily work for someone else, but it's can be a tax benefit for everyone that would really drive wellness and, quite frankly, empower patients and families as in the driver's seat of their healthcare. You know, and it also helps you get healthcare very quickly when you don't have to wait for insurance authorizations. I had my own experience where I wanted an MRI very quickly, called 5 or 6 places, and before they asked me my name, they asked me what insurance I had and to give them the member number, group number, and was told, you know, you'll have to wait 3 or 4 days for authorization for the dye. That was a part of the MRI. And on the 7th place, I was like, I have an HSA. I called and said, I'm not using insurance today. I'm self-pay. And they said, okay, come by this afternoon. It'll be $250. No problem. I left with my CD, and then the next day brought that to my doctor. I went back through to see, okay, if I did use my insurance, I would have had to wait about 4 days to get the appointment. What would my cost have been? So I paid $250 out of my health savings account. I would have paid $300. I would have paid $200, I'm sorry, for the copay by using my insurance. So I spent $50 more, but was able to get access to higher quality care very, very quickly. And that's the secret sauce when it comes to health savings accounts.
Pre-tax, too.
Exactly.
I mean, you said before we came on, you look at it like everything you purchase on that account is a 25% discount, essentially.
That's right, because of the tax advantage. So everything that comes out of your HSA, even if you're not getting a deal on it at the store, you're getting a deal on it by using that tool, which is so fantastic.
One of the things about Obamacare that I really had no idea about, and then the more I've looked into it has just driven me insane, are the 10 essential health benefits that have to be in every single plan on the marketplace.
Yes.
Well, I'll just give you a couple of them that don't really work for me, but mandated coverage for maternity or newborn care, even if you're a single male. So I'm subsidizing that.
Yeah.
Mandatory pediatric dental and vision, again, even if you don't have kids, that's in your plan. Mandated substance abuse and mental health coverage, you know, but that's regardless of personal situation. So let's say you never took a sip of alcohol, you never touched a drug in your life, but you're subsidizing substance abuse.
Yeah.
Those were forced in there.
Yes.
I mean, and when you peel back the onion on Obamacare, it does seem like the lobbyists wrote this bill, and then the American people got stuck with it.
To me, the best analogy I've heard is that it would be like if government got a hold of the pizza industry, they would say no one can buy a cheese pizza or a pepperoni or even a 2-topping pizza. Everyone has to buy, every pizza you buy has to be the deluxe, all the toppings, extra large pizza, even if you just want a single person cheese pizza.
Yeah.
But that's what government has done is they've made it super expensive no matter what you're looking for.
Yeah. And even if on that pizza, you have to pay the deluxe price. But even when you get the deluxe slice, if you pick off every topping, it's still going to cost a lot. And by the time you pick off all the toppings, you're left with just like a little cheese and sauce. Like it's not a great quality product. Nobody's excited to eat that pizza. But in terms of, the lobbyists writing this bill, I remember tracking when it was passed and how there were just things completely being thrown in at the end. The bill number kept changing. The number of pages in the bill kept changing while they were voting on it. So
K Street was getting a hold of it.
Yes. And I think that was when Nancy Pelosi had her line of, well, we have to pass the bill for you to know what's in it. And we found out what's in it. American families have been struggling with higher costs and everything, but healthcare has been astronomical. I mean, we're talking almost $30,000 in out-of-pocket expenses for some of these federal health plans that were supposed to make healthcare more affordable, more accessible. Huge benefit from Obamacare went to the insurers, and it allowed insurers to increase their prices no matter what, because even if they were going to raise premiums so high that the consumer, the patient, was unable to pay, the government was just going to subsidize the rest of it. So what happened? Over the last 10 years, they've risen their premiums by 75%. I mean, there is one aspect, one beneficial industry and subset that loves Obamacare, and that is the insurers.
Yeah. And what we did was we turned them into basically the waiter at a restaurant, because the waiter at a restaurant is going to, if you ask them what's the best thing on the menu, they always point you to the most expensive items on the menu. Surf and turf, right? And because they know they get 15% of whatever it is that you choose. So why, if you're the insurance carrier and we have to operate on 15%, then now their motives have shifted. The motives of the insurance carriers used to be to drive down the costs. Instead, why drive them down when we get 15% of whatever the costs are? So that is really a backwards way of doing things.
And that was how they got insurers on board, because insurers at the initial concept of Obamacare were saying, this is not going to work. And they said, no, we'll take care of you. And then the ship sailed.
And these are direct payments from the Treasury.
Yes.
And so why wouldn't they love it? It's like direct deposit hits every...
Always on time.
The government's paying, I guess it's just automatic.
Yeah.
Kind of wild. Okay, let's finish with this. I think it's important. I mean, you're, behind the scenes working to try to get legislation moving. There are a lot of, seems like cooks in the kitchen right now throwing out ideas, but just kind of take us behind the scenes and what are lawmakers talking about in terms of real reform?
Yeah, this was something that early on when we were doing the One Big Beautiful Bill, I was in conference saying we should be addressing healthcare.
Yeah.
We need to be, why, if we're going to do this, why not just take this up? And I got immediate pushback because politically the timing wasn't right. It wasn't pregnant. The moment was not pregnant yet, like it is today.
Yeah.
So I'm happy because I've worked in healthcare in the IT consulting space for 20 plus years, and I've got a lot of ideas on where we can save some money.
Yeah.
And that's why we've been putting together a white paper. The moment we went into government shutdown, when we were on vacation,
after doing your job,
right? My team, suddenly we shifted and we went heads down to draft new policy as a alternative to Obamacare, and so I think that it's really refreshing to hear people like Rick Scott, Ted Cruz, Senator Cassidy, and even Donald Trump are now not only talking about this, but when you listen to what they're saying a lot of what we've been saying tonight. And what it seems to be steering towards, I think, is some kind of product or a tweak to existing products like an HSA that will do that, like give people choice. What I think is also exciting, what my team is doing, working with Robert Kennedy Jr.'s office to kind of discover what can we do to not just buy health insurance, but like true, like healthy food and health care on the front end so that people are not spending so much money on the back end. And so we're exploring some of those options. How do we create a tax deduction for people who want to buy and purchase vitamins or purchase protein and produce, like, things that are unprocessed. I mean, imagine if you one of the complaints people have today is the affordability of food. You go to the grocery store and you buy a steak, or you buy, whatever it is you're buying, it's a lot more than it used to be. But if you knew, okay, suddenly I've got a 25% discount because I don't have to pay taxes. I don't have to work 25% harder for the money that I'm going to use to buy this protein.
Yeah.
That suddenly, now I think you're getting people's attention.
Yeah, it's shifting the incentives, really, and that's what I think is so cool about the healthcare debate that's happening now. I shuddered when you were talking about the 2013, 2014 messaging, looking back now, because the way we're talking about it is different, right? The president is saying, why should we give all of this money directly to insurers? Why can't we give that to the American people and allow them to shop? Why can't, through RFK and his Make America Healthy Again movement, why do we need to be funneling so much money over here to the processed food companies, to pharma, to all the above that are wonderful industries and have absolute places in this world, but have set up such perverse incentives to have a really unhealthy population physically, but also fiscally, right?
Yes.
When we talk about affordability, healthcare is a kitchen table issue. It's something that every American family right now, we're in middle of November, is sitting down and talking about. They're looking about their plans. They're looking at their coverage. They're looking at, what this will actually mean for them. So when we can compile all of that together and you start peeling back the onion, it's all about incentives. What are we incentivizing the American people to do? What government subsidizes, we always get more of, right? So if we are subsidizing, high cost plans that are low quality, restricted access, we're going to continue on that downward curve. If we're subsidizing really unhealthy foods, we're going to continue to have a really unhealthy and expensive population.
Which is what we do with SNAP.
Exactly. That's exactly what I was getting to on that. And we just get in this wicked cycle that feeds into each other, and that large industries benefit from, big insurers benefit from, but American patients and families absolutely do not.
The sinister side to this is that you almost wonder if, like, health insurance companies, hospitals, such a for-profit industry where it's like, do they really want a healthier population?
Yeah.
I don't know, but we should be, because we're very unhealthy, and that leads to a lot of additional costs.
They could adjust their business model for a healthy population. And I do think that there's tons of opportunity and innovation out there. This isn't a pie where if there's not a big enough slice of unhealthy people that these industries go away. But I do think that they will be forced to transform. And just because the status quo has been working for them and their profits doesn't mean it's working for their customers. And in healthcare, American families and patients are customers. We're disempowered consumers of healthcare, and that's what really needs to change.
Well, and it's sad you've seen the evolution of hospitals. Most hospitals began as a true charity.
Yes.
The Catholic Church had a lot of hospitals. I don't know if they still have them today. In my community, they don't.
Yeah.
They don't directly. It's all now corporate. And so, that is a huge role in this aspect, is that charitable aspect. When your neighbor is in need and they can't afford their bills, how do we address that?
Yeah.
I tend to think that it's better addressed through a true charity than to funnel that money through a government bureaucracy. But I think that what this may kind of open up another opportunity to provide with these kind of accounts and structures, a way for people to seek charity within their HSA or with their new account, right?
Yeah.
So imagine you suddenly are diagnosed with hemophilia or breast cancer or whatever, and there's a community of people that are donating to that topic, or anybody that has that need.
Yeah.
If you could make yourself available to that, suddenly you start encouraging people with the tax deductible donation to take care of their friend or their neighbor.
Yeah, this is what I
That's
mean.
radical.
That's great.
This is what I mean in terms of a difference in conversation from 2013 to 2014. And this is also what I mean in terms of Democrats playing to emotions with kind of overblown fear mongering. This is not playing to emotion, but actually would render emotions because you're solving the actual problem and people can connect those dots. And that's what makes me so excited about the moment right now and the way the congressman's talking about it and the way the president is talking about it, because that wasn't there before and these solutions were not there before. We had one bill, one repeal, you said the milquetoast bill, and that was it. And then it went crickets for over 10 years. That's not what it looks like on Capitol Hill now in terms of conservative leadership on healthcare and Republican solutions for the moment that we're in.
Look at you two, very optimistic.
I think we solved it tonight.
Yeah.
I feel great.
This is a half glass full kind of crowd in here tonight. Anyhow,
In DC, of all places.
Lauren Stewart, thank you so much for joining us. Great
Yeah.
information.
Thank you so much for having me.
Congressman, thank you. I know this is a very passionate topic of yours that you will continue to fight the good fight on. So
Thank you both.
you can watch or listen to Fresh Freedom across all podcast platforms. Be sure to like, share, and subscribe. Stand strong, stay informed, and keep fighting for freedom.